Hey everyone! In this video, I'm going to talk about what spasticity is, why it happens, and cover the 7 Brunnstrom stages of stroke recovery. Hang with me if you've never heard of those stages before. If you're new here, my name is Elyse, and I am an occupational therapist and certified stroke rehab specialist on a mission to make stroke information simple. If you find this video helpful, please like and share, subscribe to my channel, and hit the bell to get notifications on when I post new videos. All right, let's get into it. So, what is spasticity? It's a complex topic and it can be difficult to understand. First, let me start out by giving you the medical definition, and then I'll break it down with an analogy. So, the medical definition is this. Spasticity is a type of abnormal high muscle tone that is velocity dependent. Blah. High muscle tone essentially means that there is a significant tension and tightness in the muscle that makes it challenging to lengthen and stretch. Velocity dependent means that this tension and tightness is worse with quick movements versus only being present with slow movements or stretching. To make this a little bit easier to understand, let me tell you the story of the rubber band and the spindle. Now, if you have read my blog article, The Simple Guide to Spasticity, this description will likely sound a little bit familiar to you. Picture a rubber band. It's elastic and can lengthen and shorten. Now, imagine that rubber band is being stretched to its breaking point. What happens? One of two things. It either snaps back to its shortened form or it breaks. And we have different types of sensors in our muscles that provide our brain with information about the status of those muscles. These sensors let our brain know that we're right side up, where we are in space, which is known as proprioception, and some sensors, along with reflexes, act as a security system to make sure that our muscles aren't being damaged. That last point is what we're most concerned about with spasticity. The sensor that plays a role in spasticity, or the largest role in spasticity, is the muscle spindle. And these spindles detect changes in muscle stretch and length. The muscle spindles cause our muscles to contract if they sense that the muscles are overstretching. It's a protective mechanism called the spinal stretch reflex. And this is where we get into the real meat and potatoes of spasticity. So in the rubber band example, if the rubber band had a muscle spindle, the spindle would tell the band to snap back to its shortened form in order not to break, to protect it. It would trigger the spinal stretch reflex for the muscle to contract, or for the rubber band to contract. Because the spinal stretch reflex, which results in a muscle contraction, needs to happen almost instantaneously to avoid muscle damage quickly, the signal doesn't travel all the way to our brain and back. Instead, it travels from the muscle to the spinal cord and then sends a message back to the muscle from the spinal cord, which is why it's called the spinal stretch reflex. Now that we know what spasticity is, let's talk about why it happens. When someone has a stroke, a brain injury, or other neurological disorder, spasticity can occur. So where is the breakdown in the body that causes spasticity to happen? After a stroke, there are 2 primary areas where that breakdown happens: the muscle spindles / stretch reflex and the brain. The spinal stretch reflex becomes hyperexcitable and abnormally triggered, and this results in abnormal muscle contractions, leading to that increased muscle tone and spasticity. And the other area of breakdown is that the injured area of the brain is unable to successfully communicate with the spinal cord and the peripheral nervous system, everything outside of the brain and the spinal cord. The brain is unable to inhibit these hyperexcited stretch reflexes at the spinal cord level, which is what it would normally do. So instead, the spinal stretch reflex continues to be abnormally triggered and the brain can't tell it to stop. This results in the muscles continuing to abnormally contract, which leads to that high muscle tone and spasticity. Now that we know why it happens, let's dig into how muscle tone and spasticity change after a stroke. There was a Swedish-American physiotherapist, Signe Brunnstrom, who developed the Brunnstrom approach and stages of stroke recovery back in the 1960s to help medical professionals and survivors to better understand muscle tone changes and recovery after a stroke. In a perfect world, we'd see someone move through those stages until they reached a normal or typical muscle tone and movement. Often, though, survivors can get stuck in one of these stages. So let's walk through each one of those stages and talk about what's happening and what you can do. Stage 1, flaccidity. This stage happens right after the brain injury occurs. There's usually no voluntary movement, and recovering limbs may be limp. The brain cannot communicate with the muscles due to the brain injury and nerve cell damage. The goal in this stage is to protect the limb. You can use positioning strategies to protect joints and to avoid shoulder subluxation, which is minor dislocation at rest or with activity. Stage 2, spasticity develops. A small amount of spasticity and basic limb synergies develop in this stage. And limb synergies mean that there are multiple unwanted muscle movements occurring at the same time. The brain isn't able to get the correct signals to muscles, and muscles begin to move in this stage, but it's usually involuntary. This is when you might see elbows, wrists, or fingers start to bend without really trying. And even though there's little motor control, keep moving your recovering limb as much as possible. It's common to develop something called learned non-use, which is where you don't use your recovering limb or limbs because of limited movement. The neuroplasticity principle of use it or lose it is especially important in this stage. If you can, self-stretch or have someone help you stretch daily to maintain muscle length. Stage 3, increased spasticity. Damage to neural pathways from the brain to muscles can cause the muscles to contract too often, as I explained earlier. That hyperexcited spinal stretch reflex and inability to inhibit that reflex from the brain leads to tight, stiff, and sometimes painful muscles, resulting in limited movement. In this stage, you can use splints to prevent contractures, which is a shortening and hardening of muscles or tendons. You want to continue to self-stretch or have someone help you stretch your recovering limb daily. Talk to your doctor about certain oral medications, Botox injections, or even acupuncture that may help relieve stiffness and pain. There's a lot of high-level evidence for the use of Botox and acupuncture or electroacupuncture in the treatment of spasticity. And lastly, as much as you can, try to limit your stress levels, as that can also increase spasticity. Stage 4, decreased spasticity. Spasticity finally begins to reduce in this stage. Some voluntary movement returns with improved control. Capitalize on this stage. You can use functional e-stim or electrical stimulation. Just make sure to get approval and instruction from a medical professional first. Move your recovering limb as much as possible, either with assistance or independently. Incorporate your recovering limb into as many daily activities as you can, like getting dressed, taking a shower, or even making a meal. Stage 5, minimal spasticity. In this stage, brain signals to recovering limbs improve. You can start to perform more complex movements voluntarily. Start moving towards active range of motion, where you're moving independently rather than having somebody else move you, and focus on strengthening exercises and controlled movements. Continue to use your recovering limb as much as possible in everyday activities. Repetition and consistency are key. Stage 6, no spasticity and return of coordination. In this stage, spasticity completely resolves. Motor control is almost fully restored except for some lingering coordination issues. Continue to focus on active range of motion and strengthening, but include exercises and activities focused on fine motor and dexterity skills. This is where you can really hone in on some of those more deliberate movements. Stage 7, typical movement. Spasticity is not present. The brain and muscles are communicating effectively. Typical movement returns. In this stage, keep actively moving and strengthening your whole body. All right, everyone, that's it for today. Remember, it's important to understand that there aren't really any specific timelines for moving through these stages of recovery. Every survivor's experience is different, but improving your understanding of what stage you're in can help you to advocate for appropriate treatment. Thank you so much for watching, and I will see you next time.